Imagine this. You're sitting at the kitchen table talking with your grandma. You laugh about that funny thing that happened yesterday. But then you notice that something is off. You try and get her attention, but her eyes stare off to the side and she has trouble speaking. Your heart starts racing because you can tell that something is wrong. What would you do in this situation? Here's what you need to know. In the same way that people can get a heart attack, they can also get a brain attack, called a stroke. When the brain stops getting the blood that it needs, it can get damaged and stop working properly. Getting to a hospital quickly after a stroke can save lives. And there are treatments that work early, which can improve people's ability to function after they have a stroke. This is especially important here in Chicago, since hospitals on the South Side are closing down and restructuring. Residents on the South Side already face greater burdens to their health just because of where they live. They have less healthy food options, less access to transportation, and less doctors. Not only does this limit access to preventative care that could help reduce risk factors, but it also impacts access to stroke treatment. So, when hospitals start closing, that adds yet another hurdle for patients to get the care that they need. While some things are not easy to change, we have a big power to help people with stroke in our communities. One of the really important things we can do is be on the lookout for signs of stroke and then immediately call 911 for help. Here's a quick tool that can help you help your community. If someone seems off to you, think fast. F, face. Do their face or eyes look different? A, arm. Is their arm weak or balance off? S, speech. Are they having trouble speaking? And T, time. If you think something is wrong, get help. Keep it simple. If your gut tells you that something is wrong, it's time to get to a hospital. The quicker you get to a hospital, the better. I just saw a patient in the hospital. Let's call him Joe. He came in because his speech was slurred. Joe had had a stroke, but he didn't have anyone around to catch the signs. He ended up with permanent speech difficulty. Had he come in when it happened, there could have been medicine we could have given to help. Communities have always been strongest when they stick together and look out for each other. When it comes to health, it's no different. While we work to fix big issues in access to healthcare, we can make a huge difference for each other by quickly spotting medical emergencies like stroke. So, next time you're sitting across the kitchen table, chatting with your friends and family, and you get the sense that something is wrong, don't freak out. Just take a deep breath and think fast. You might just save a life.